As our panelists or panel two get ready to join us, I have a quick 2-minute video from Jason Barr from ID.me.
Hi, my name is Jason Barr, Vice President of Healthcare for ID.me. ID.me is the largest digital identity verification platform covering more than 116 million verified identities, of which there are already millions from healthcare. We serve as the secure front door for the IRS, Social Security, and Veterans Affairs, as well as 600 other digital destinations. Our mission is to make online identity just as simple as using a driver's license at any front desk to prove that you are who you say you are. We're excited to present this incredible panel of leaders and experts from the Caring Alliance, DirectTrust, the EHR provider, Veradigm, and OtisHealth, a personal healthcare app, to talk about identity verification and why it is critical to delivering enhanced provider support and extending patient healthcare. What can you expect from this session? An explanation of identity verification in healthcare and why it is so important. A chance to hear from experts about the challenges to deploying identity verification, a better understanding of federation and what it means for you, and we'll discuss considerations that go into your selection of an identity verification provider. We'll outline patient matching and how it's different from verification, yet important to deliver an effective interoperability landscape. And finally, we'll review the benefits of identity verification for your organization, like providing simpler access for providers, staff, and patients with one portable login they can use anywhere, both in healthcare and beyond. How it prevents fraud and reduces risk, and why you need to ensure that your users have access to help and support 24/7. If you're interested in ID.me, check us out at our website, id.me.
And now if you could, please take a few seconds to read the bios of our moderator and panelists.
Okay, thank you very much, Carol, and welcome everybody. My name is Kyle Neuman, Director of Trust Framework Development at DirectTrust, and I'll be the moderator for today's panel session. This topic is, of course, very close to me, but I suspect many of you have noticed that digital identity is playing a much larger role in interoperability discussions now than at any point in the past. It's part of enabling patients access to their data inside and outside of TEFCA, to electronic prescribing of controlled substances, and even prior authorization. All of these topics will have an intersection at some point with trust and identity. We have assembled a set of panelists with a diverse set of perspectives to discuss this topic today. And we have a lot to talk about. We have 40 minutes, 4 panelists, and a lot of different questions that we'd like to get to. So without further ado, I'd like to introduce our panelists here and get started. First, we have Jason Barr from ID.me, who represents the identity provider side of our discussion. We also have Ryan Howells from the Caring Alliance, who represents the Industry Alliance, Standards, and Federation side of identity. We have Marc, Mar-Yohana from OtisHealth, who represents the patient-facing app side of healthcare. And last, but certainly not least, we have Lindsey from Veradigm, representing the EHR, provider, and identity infrastructure perspective for our conversation. So with that, let's jump right in here. And I'd like to start, as Jason pointed out, with the why. I think that's one of the most important things to start a conversation like this off with. So Marc, we're going to go to you first. From your perspective, how does identity verification help enable healthcare interoperability? And then we'll go to Jason.
Hi, Kyle. Thanks for that question. And I'm honored to be part of this panel. So for us, it's really important that as members are joining OtisHealth, that they identify who they are. So there's no doubt when they're reaching out for health records that's their record that they're reaching for. And so if you think about it, what we need to make sure is that to make sure all our health records are secure, we only want to provide access to those that are verified, and we need to verify them at a level of assurance that's high enough so that our partners in the healthcare industry, such as a health system or a health plan, can be assured that the person that's requesting their health records is who they say they are. So for us, it's a matter of basic enablement. So with the digital health, with the digital identity, we have far more assurance that the people that are joining OtisHealth are who they say they are, and that when they're retrieving records, that they have a right to that record. And so we, as everyone on this panel knows, we're partnered with ID.me for the IAL2 verification, which really means that for us at the identity assurance level 2, it's the best remote monitoring or remote identity proofing we can get onto our platform. So we know we have absolute confidence that the people that are signing in and requesting their health records are who they say they are.
Thank you very much, Marc. And Jason, what do you have to add there?
Sure. So identity verification is really the front door to making interoperability happen. A patient or a provider accessing patient healthcare information needs a easy, seamless, frictionless way to get to the next steps before data is shared and records are accessed. And so there needs to be the right policy attached to the right individual to access the right information. And so that's what we focused on, is making it, broad so it fits all these different use cases, and the fact that it's trusted and it's portable. So whether the patient is accessing records through Marc and OtisHealth, or through Veradigm and the EHR, or through a personal tracking fitness app, or through anywhere else, they have that identity verified and trusted and with them at all times.
Makes a lot of sense. So really, I'm hearing a sort of a pattern here from Marc and Jason, really around, Marc, you pointed out access. Without a trusted identity, really the provider is not going to allow access to that data. They need to make sure they know who is calling. Is it really that patient who's asking? And so, Lindsey, let's go to you to get your perspective from the EHR side of things. Why is identity so important for interoperability to you?
So from our standpoint, we're building solutions for providers, but we also build solutions for patient access. But even outside of our portfolio, it's really about that customer experience. Every time a user or an individual is trying to access the records, book an appointment, check test results, do all those things, they really do need to be able to sign in somewhere. Typically, those are digital experiences. Every time we fill out a piece of paper, we've missed an opportunity to kind of fix that, right? To really allow that identity to be portable and to ease that experience, right? I think about my experience, picking up prescriptions for my wife, taking care of my son. We were at the doctor's this morning, no surprise, because he's sick, right? Sick. And so I think about that and I go, all right, there's all these interactions across text messages and apps, et cetera. It'd be great if I could have my identity verified, his identity verified, and the network and the solution know essentially that we're related and I'm on his care team, essentially. So look at this from the provider standpoint. We say, all right, we're always concerned about things like EPCS, and is that the real clinician that's supposed to be signing in to do that app, or to use that application, or do that workflow, or submit that lab result? But that experience is still a consumer one, and it applies to the patient side and their care team as well. So
very interesting perspective. So you brought in sort of the business to business side of things too. Providers need identities just as well as patients do, of course. Ryan, the next question is over to you. But before we get to that, do you like to respond to anything Marc, Jason, or Lindsey commented on?
Yeah, Kyle, there's a lot for me to respond to. I'm so excited about this topic. Can I just tell you what we're not talking about today? What we're not talking about today is enterprise master patient index number. That's behind a firewall. What we're not talking about today is blockchain. What we're not talking about today is self-sovereign identity. What we're not talking about today is a national patient identifier. We are not talking about any of those things. So put all of those things in a little box over here, which my hands just keep being invisible because of my background. But that's in a box, okay? What we are talking about is a portable digital identity credential that is API and OpenID Connect based that someone could actually authenticate across multiple systems. They, by choice, choose to create one and they could use it. Think of it as a single sign-on for healthcare. So Lindsey mentioned for providers and for patients. So Lindsey mentioned EPCS. Lindsey, we love acronyms in healthcare. EPCS, electronic prescribing of controlled substances. It means that every single provider in the country who actually issues prescriptions has to actually be certified, and they need to know that you are who you say you are. Dr. Hall is Dr. Hall, right? And so they have to get identity proofed and for them to actually issue these prescriptions. And so for that to happen, they can actually get identity proofed at this IL level 2 assurance level to make that happen. Doctors have to log into multiple portals and multiple systems today, right, to make that happen. What if the doctor could actually just use one identity credential, username and password? Let's use this for now. It's not the best, but we can talk about that later. And then authenticate themselves to any of the portals that they use on a regular basis. Now, take that and take that same infrastructure and then point it to the patients and say, now as a patient, I can use one identity credential and log into OtisHealth and get my personal health records, log into Allscripts or Veradigm, sorry, Lindsey, Veradigm, and get my clinical data. Sorry, it's a Freudian slip. Get my clinical data. I can log into Humana and get my claims data. And it's really the consumer perspective side of this is log in with your ID.me credential or your Clear credential or any of these other ones. The other valuable thing, just to set the table here, Kyle, is these are free today to consumers. In fact, our audience, our 200 plus folks that are out there, can go get one today. I think probably everybody on this phone call is on LinkedIn or on LinkedIn. As a result of that, you can go to LinkedIn right now and for free create your own Clear IL2 credential. Do that today. Easily done. If you're a veteran, you can log in and get an ID.me account right now on the Veterans Portal, right, Jason, to make that happen. Or next time that you file taxes directly with the IRS, some of us use TurboTax and other things, you're going to get an ID.me credential. In fact, if you do that at the end of the year and you're filing your taxes directly with the IRS, you can get an ID.me credential. We think roughly 85 million Americans, Kyle, already have one. They're in 26 states right now largely because of ID.me in terms of unemployment insurance. So even the most vulnerable have one of these things too, because they got the unemployment insurance during COVID. I would just say that this is actually now live and in production. The only thing that we need to determine as healthcare is whether we're going to adopt it or not. That's the key question for today.
Thanks, Ryan. Okay, so that's a great framing of why are we having this discussion? Why is identity important? What's the opportunity really at hand? So makes the most sense to go right next here, Ryan, over to you. What's holding us back? What are the hurdles that healthcare is facing?
Well, so a couple of things. We have this thing called FHIR we've been talking about for more than a decade, and it just isn't quite scaled yet, unfortunately. Now, there's a lot of great work that a lot of great people are doing, and we're trying to move as fast as we can. It makes a lot of sense. In the Karen Alliance, we've been working in FHIR in production for more than 8 years. I think we're the largest community of in production FHIR-based applications anywhere in the country. So we've learned a lot from this process. And what we've learned is we need identity. We've got to have identity. It doesn't work. If we don't have digital identity, it doesn't work. None of this stuff actually scales for both providers and patients, by the way. And I know Karen doesn't talk much about providers because we're only focused on the consumer side, but it's the same infrastructure. It's needed for both. So for us, and Lindsey's going to tell a story later about his provider community, but the idea is that how do we find a way to scale it? And what's most important right now, if I could say one thing that we need to work on, is the EHR vendors have to be able to accept an OpenID Connect credential. Now, we could go back in time. It was supposed to be done 2 years ago, yada, yada, yada. My understanding is they're just starting to come online with the support for an OpenID Connect credential. And so does the app community, and so does the health plans as well. By the way, ONC and CMS, thank you very much, required that everybody actually implement this OpenID Connect credential. So if everybody does that, we are one big step in that direction of how we federate identity. When that happens, then we can start thinking about, okay, now how do you, inside of a health systems firewall, take all the point solutions you have and make sure you have an identity framework that works for all of them? Because right now, these point solutions aren't working and they're not scaling because of the fact you have all these authentication layers on top of it. It's garbage. We need to figure out a way to say, log in once and I'll get you to all the point solutions that we've bought over time. Some hospital systems have 3,000. It's crazy. Okay. That's for patients. For physicians, very similar. How do we do that? We can do that easier if everyone moves to more of OpenID Connect. And then we can talk about federation across systems, Kyle, and the work that we've done over time here in the future. But we're ready to go on across systems too. We need to actually run through a pilot, which we can talk about some of the pilot work we did last year.
That's right. Jason, I saw you came off mute. Did you have something you wanted to add?
Oh no, I was just muting. But I agree with Ryan. I think the key is federation, right? And so when you look at identity as an organization, picking security is just the first step. You make sure that you've got security, verification, and access. But if the patients and the providers can't use that across all these disparate systems, that's where interoperability will fail.
Makes a lot of sense. Lindsey, anything to respond to Ryan's comments about hurdles from your perspective?
Yeah, I do think it's that technology layer, and I'll often talk about the provider experience because we're building applications for providers, at our company. We also build applications for patients, but the problem set is the same. It all comes down to the federation and the technology and the protocols, like Ryan and Jason mentioned. OpenID Connect is a really great way to get there, but we've got applications that span decades of healthcare technology, right? And those applications are going to take a long time to get up, either replaced or updated or improved to allow this to happen. But I think if we can get there, it's kind of that snowball effect, right? The more we do, the more valuable the experience becomes, the more people are going to have a credential that's portable, right? And we've had a great experience with ID.me. But obviously there will be other vendors out there, right? So the federation capability is going to be critical to allowing, the patient who uses Visa or the patient who uses MasterCard to still pay their medical bill. It's that same analogy, whether you use ID.me or Clear or some other company that we haven't even heard of yet. They're going to need to be able to sign into this network. And, myself as, working on the EHR side of the house, when we're accepting data from other systems, we should be able to accept that in kind of a transparent way and not have to say, well, we have a special solution that came from this one vendor and a special solution that came from another vendor, right? We've got to really make that, Visa, MasterCard, American Express, Discover network really kind of pan out, right, for the consumer side. And the last plug that I'll put in there that I think is really kind of the mindset that I always use, and I'll talk a little bit about this more later, is that when we think about providers versus patients, providers are patients too. Everyone's a consumer. So when we think about the experience that we want folks to have, identity proofing and getting verified, it needs to be easy, it needs to be secure, it needs to be ideally painless, right? And something they can do quick and easy, right? Better than that, walking to the DMV sort of experience to get your driver's license, right? We want to do that online and make it simple. And I think that's the key to providing the access, to everybody that needs that access.
Excellent points. So we sort of have moved on to discussions about federation. And this is certainly an area that I spend a lot of time thinking about. And, there's a lot of facets to it. Federation can be viewed as a strictly technical exercise. But anybody that tries to do it realizes pretty quick that it's really not. Just like with anything, the technology is frankly the easy part. It's consensus potentially is one of the most challenging aspects of federation, arriving at some kind of an assurance level that everybody can agree to so that you can, in fact, federate one identity at one organization across many other organizations. So Ryan, to you first, and then Marc, I'm curious to hear from you on this as well. What's your perspective on consensus? How can healthcare achieve a level of consensus through federation to allow an identity to be federated across organizational boundaries?
So there is a level of federation has to do, as you've so aptly taught me, Kyle, with liability, with risk, with technology, with policy. All that stuff has to come together in one nice little package. As you and I know painfully well, we've spent the last 3 or 4 years working on that little package in a skunkworks group inside of Karen. I will tell you that I feel like we're ready, and I feel like we're ready to test this at scale. And folks seem to forget the fact that DirectTrust has been doing this for more than a decade on the PKI side. So, and you've been doing it for a long time as well. This is not like newfangled, strange, like, bizarre stuff that's going to happen that's never happened before. We've done this at scale. We can do this again. And we're just going to do it with more modern technologies to make this happen. So I think the idea is, again, use existing frameworks, use existing trust frameworks that we have, find ways to modernize them. So we've been working on a policy document that links together the PKI ecosystem, which is, for all the nerds out there, RFC 3467, which is related to the stuff that DirectTrust works on, and then mirror that with NIST 853 and 863, which is the PKI-based ecosystem. Those two worlds are coming together. So we have a single policy document that then says, hey, there is a consistent way that these specific identity credentials, when they should expire. Like there's an agreement across those different technologies of when they should expire and how they should be renewed and all the detailed elements of how that works. So that's all details for this group. I think the key point here is that if I'm a provider or a payer or a third-party app, the thing that I'm doing like tomorrow to take advantage of this is I'm getting OpenID Connect implemented immediately. Like that's the thing that I want to do. And I'm telling my vendor if it's not on their product roadmap, to get it on their product roadmap. And then the next thing I'm going to do is figure out a way where I can either have a relationship with and one of these ID vendors like ID.me and others that are out there, or I can figure out a way where I can accept one of those ID credentials once I have OpenID Connect in place. The rest of this stuff, Kyle, to your point, how it integrates with TEFCA, how it integrates with the RCE, and what's happening with all the stuff with SOPs, and anyway, all the acronyms that we love throwing out there, that'll all kind of take care of itself. I think that's more of the things that are happening behind the scenes. We need more people right now just getting the core infrastructure in place so we can start to test it at scale. And then we'll see really cool things like, hey, either log in with your Epic MyChart account or log in with ID.me or one of these other potential vendors that we have out there so that you can do that on OtisHealth and aggregate all your data. A provider can do that on Veradigm and be able to log into multiple portals. All this wonderful stuff will start to happen once that kind of core baseline stuff starts to happen.
Thanks, Ryan. So, Marc, you've been involved in a lot of these federation discussions. The Karen pilot, you joined the individual identity technical work group at DirectTrust on a regular basis. So consensus has sort of been a major portion of what you've been participating in this effort. So any insights from you with respect to federation, consensus, the sort of whole topic of how we can all interoperate with each other?
Absolutely. So just to put everyone on the same level here in terms of what our perspective of OtisHealth, we advocate for patient access. So we have families, caregivers, and people with chronic illness that use OtisHealth, and they need to aggregate their data from different sources. And the way it works today is they really need to log in to every single location, meaning that they have to ID proof. It's almost like you're going to a hotel in a new city. And every time you go to a hotel, you not only have to present your ID, you have to present that hotel's ID. So you have to actually prove yourself every time you walk in the door. And that's a barrier to efficient health data exchange, which really means it could be a barrier to healthcare, because our goal is not only for the people to collect their data, our members to collect their data from different sources, but then share that back out to their health team, to their care team. And so when we're talking about federation, we're really saying that, hey, I should only have to prove myself once to one organization, and that organization should be trusted by the rest of the network, to the rest of the healthcare ecosystem, to say, okay, well, we know OtisHealth, they're a registered entity. They follow the same standards we do for ID proofing. We should trust that as their members are requesting data, we don't have to go through ID proofing with them again. As a person with chronic illness today may have currently today 5 to 10 different healthcare systems they interact with. Literally, I as a healthy person have 5. And so it's, if you're a caregiver, it's even more difficult. And so for us, the idea of ID federation and it was really, as you mentioned, Kyle, it's not a technical challenge. It's really a policy and trust challenge. It's really a matter of organizations saying, hey, we understand the technology and we understand we need to work together because we also have a common mission of providing healthcare. So it's not just providing efficiency for patients. It's also for physicians that want to more quickly receive health data, the most accurate health data. It's breaking down these barriers, effectively federating digital IDs is a way to break down these barriers that make it more difficult for physicians in different institutions or organizations to get data shared to them by a properly permitted source, such as a patient who's ID proofed themselves. So for us, digital identity is like the core of being able to enable trusted access across the network, and federating it just means that we don't have to have a driver's license for every state that we enter. We have one driver's license accepted by all states, just like it is today with our driver's license. I don't need a new driver's license when I go to Utah or Illinois. So this is just a way to, we already know this exists in industry. It's a matter of policy and practice and some trust to really get us to the point where we can use this federated identity concept.
Well said. Well said. So with that, we've talked about the why, we've talked about the hurdles, we've talked about what federation is and why consensus plays a role. So let's sort of shift the conversation into, all right, action. I'm interested in an identity provider, but I don't really know much about it. What kinds of, and Jason, really curious to hear your perspective from the identity provider side. Really, what kinds of questions are your customers suggesting they need? What are the requirements? What are the kind of considerations should they be thinking about when they're looking at an identity provider? Any insights you can have with respect to the customers that you have helped?
Sure. So the first one is level of policy, right? So who is my population that I'm trying to give access to? What are they going to access? And that's different between patients and providers, and healthcare is moving towards an IL2 standard. So that's a very high standard that they need to be able to deliver. The second is how much friction is in that process of being verified. And we focus a lot on creating a frictionless sign up and the transportability of that verification to wherever they need to use it in healthcare. And so what that means is we do all of the hard work. We don't ask them to remember, like basic verification systems, ask them to remember, what car were you driving 15 years ago, right? The failure rate is actually pretty high on those knowledge-based questions. And so we've used our technology to take it to the next level and integrate with the data systems that are now out there and available to then validate that this is the individual, they've presented the right documentation, and the systems also that we connect to verify that this is the individual. The next thing that's come up a couple different times is equity and access. Healthcare cannot be for those who are experts at using modern digital tools and the newest smartphones. It's got to be available for everyone. And so, two things that we really focused on that deliver equity and access for everyone in healthcare is 24/7 support. So when someone can't verify their identity, but they need to access healthcare information, we're there to help them through that 24/7. The second is utilizing different tools like video verification or our trusted referee or our provider fast lane, depending on who's trying to access and verify their identity. we're actually able to identify those populations that have trouble with older systems, verify at very high 90+% rates, which gives everyone the ability to connect with their health systems, their clinics, their doctors. And we've talked a lot about patients and providers, but Marc mentioned caregivers. As a parent, you're a caregiver. You need to log in for your children. You need to log in maybe for your elder parents. And so being able to receive that approval and then verify that I'm the caregiver for that person just extends that equity and access for everyone.
Makes a lot of sense. Thank you for that, Jason. So this is really, Jason, thanks for that perspective on the identity provider side. You know, you're really the one that folks contact when they're looking for an identity provider. Lindsey, as being somebody who has been on the other end of that communication, what insights do you have for us with respect to kinds of requirements you thought about?
Yeah, so we had worked with a number of vendors prior to settling with ID.me, and one of the things that we really put a lot of thought into was what was that experience going to be like for our providers as consumers. You know, like I said, we're building software for workflows and day-to-day business, right? But at the end of the day, the identity proofing experience is very personal. It's your private data. You know, it's your driver's license with your photo on it that you're uploading, or your passport. People want to know that that's trusted and safe. And I can remember the conversations we had with end users that, you know, who is this and why am I giving them my data, right? I'm already employed here. I'm a doctor. Why don't you believe I'm me, right? And if you take that to the provider population, which is maybe, you know, whether that's doctors, nurses, PAs, you know, administrative staff, et cetera, which is maybe 1% of the consumer patient population, now exacerbate those same complaints and challenges and lack of trust, right? So we wanted something that people could trust, something that preserved privacy, something that had an easy kind of frictionless consumer experience. And, you know, prior solutions and older solutions in the past just didn't bring that. And it really needed to work across a bunch of different devices, right? We've done a lot of work with both iOS and Android users, right? And we've got different versions of phones and different versions of operating systems on all those. And we've seen just about every, I think, glitch and bug that you could possibly imagine. But at the end of the day, the consumer's going, well, I have my phone, it works for me, I can send an email, why can't I proof, right? And so, you know, I'll give a lot of credit to ID.me for working through those issues with us collaboratively. And really, it speaks to the customer service that Jason mentioned and the effort that they put into the technology, right? And so I think, you know, those are really kind of the key points. And one area that we hadn't focused on a lot that I think will become more prevalent in the patient space is really around that access and equity. Not everyone's digitally inclined, right? Some people just don't trust it. They, you know, and there needs to be options for, you know, either video proofing or in-person proofing options. So, you know, that there's not a reason you can't get access to the data, right? We don't want to be operating on paper. We don't want to have all these records that are, you know, unlinked and, you know, the 17 logins and things like that. We can't deliver healthcare effectively without identity. And so just that starting point has to be frictionless.
Hey, Kyle, if you don't mind, Lindsey, could you provide the feedback that you mentioned to us before we jumped on here about your provider community and their feedback to implementing ID.me?
Yeah, so I think we had initially, you know, we've done it now for 5 years. Initially, there was concerns, right? And we had some previous ID proofing vendors. So the first reaction we got was, okay, great, we're changing again, right? And we kept going, all right, but this is much better, right? This is going to be much better. And I had personally gone through the experience myself. So, you know, I wasn't going to put this in front of end users if I hadn't tried it out myself. And it was a lot simpler, right? Without getting into the flows, I didn't run into any issues. And I was like, all right, this went much more quickly than I expected. We can sell this. We can put this out there. And so you fast forward 5 years, right? And we work through all these challenges that I just mentioned. And what we've been hearing over the last year as we introduce ID.me and identity proofing into additional workflows is, oh, that's great. I already have an account. Oh, I know exactly how that's going to work. And one of the stats that that we just got this not too long ago is that a full 30% of all of the new enrollments onto our platform are for users who are bringing a trusted credential like ID.me to the table already. So, and they're not doing that because they used another healthcare application. They're doing that because they filed their taxes or they needed to check on their tax record. Or if you live in California, they're getting their driver's license by first going online and identity proofing and have it mailed to their house, right? There's a number of different things that are happening around the country. There's different states and countries, different states and government agencies have started to leverage their platform. And we, as an adopter with a smaller community, right, of users, feel that benefit daily, right, and that number's growing. So it's market closure on the consumer space. So
thanks, Lindsey. So
happy
that's
to share.
that's the provider side. Marc, do you have any different perspective from the patient-facing app side? I know that you've gone through more than one identity provider.
So generally speaking, our members are comfortable with the ID.me process. The nice thing is nobody came back and said we don't want to do it. So just to make sure everyone knows what we do as a company, anyone can sign up and start using OtisHealth, but to use our FHIR API features to fetch clinical data, we require that the ID proof. And so those that intend to do it understand, first of all, why we're doing it, that they seem to appreciate that we're providing an extra layer of security to protect them, as well as to give assurance to the individual organizations that they're querying to get their health records. There have been folks that require additional support. One of the nice things about ID.me as an organization is they provide live support when needed. So it's a slightly additional cost, but that's worth it for us to make sure that folks that aren't as technically inclined have the ability to actually talk to somebody and get ID proof that way. So that regardless of what platform or what organization is providing the ID proofing, I think today, from a health equity standpoint, as some of us are talking about, it's important that we provide the level of support that's required for anybody wherever they're at and their digital capabilities and experience. So overall, haven't had any pushback about why ID proofing is required. There's been a few people that needed some extra handholding, and probably the more interesting issue that we have is people change their addresses on their profiles different from what's on their driver's license sometimes, and so that creates some interesting experiences for us in trying to understand, well, how do we support people that have a driver's license with an address that's not the same as their actual home address. And I know ID.me deals with that quite a bit, but we as a healthcare community, those are the things we kind of think about, like, do people have multiple addresses? How does this affect patient matching and queries when we have members query a data at a clinical source that maybe 3 years ago, for a source where they had services 3 years ago. Yeah.
Wonderful. Thank you, Marc. So, Lindsey, we're going to go to you for the last question. We only have 5 minutes in this panel left. It's crazy how fast that time can go. Change gears just a little bit here. Talking, our one of the items in the title of this panel session was patient matching. We haven't really talked much about that yet. So I'm curious to hear from your perspective, from the EHR and provider perspective, who has to deal with this on a regular basis. How is digital identity making an impact to patient matching, if at all, and particularly exchange across organizations, if you have that perspective?
Yeah, so I think there's a few kind of thoughts around this. So there's the traditional, master patient index set of effort that every EHR company has been going through, trying to match patient records, right? John Smith versus, are they really the same person, right? It's that classic problem. And we certainly deal with that in our own EHR solution, and we have, a various sets of technologies to deal with that. But the thing that has kind of always struck me, aside from, we're going to have this process to reconcile duplicate records because duplicates are inevitable. They're always going to happen. The thing that always struck me is, what can we do to stop creating duplicates? And that's where I think the impact of a portable identity really matters. Every time I go to, a pharmacy to pick up a prescription, whether myself, my wife, or my son, or I check in at a doctor's office, or I fill out a piece of paper, like I said earlier in the call, I'm creating yet another asset that has to be, a digital asset in some system that has to be matched to other, my other records elsewhere. It would be great if I could tap my phone like I do Apple Pay or pick up my Starbucks, right? And, that's my digital identity, right there, and it signs me in, right? And I think that's kind of that future that we're all trying to drive to. And to Ryan's point earlier on the call, these are technologies that exist today. We just need to pull them together, and it's going to take a long time to do that. I think we could talk a really long time about how we actually achieve that from a protocol standpoint. And I love talking about, OpenID Connect and OAuth and all of the things that make the underpinnings of this work. But at the end of the day, that experience, that end consumer experience, is really going to drive adoption, which is going to, I think, ultimately reduce the need for significant or let's say super complex patient matching solutions, right? Which are extremely costly and they're difficult, right? To a human, if you just ask yourself, I got to look at 3 pieces of paper, is this the same person? How am I going to know that? Well, if you can't know it, how can a computer know that, right? I mean, and I don't mean to, inspire distrust or anything. I think there's some really great technologies and work that has been done over the decades to solve this problem. But I think it starts with improving the established digital identities in the first place. We've got to cut off that problem space, basically.
Excellent. So, Jason, I'd like to go over to you next, both on this topic with respect to identity resolution, patient matching, those two being synonyms, and any closing thoughts you have about our discussion today.
Sure. So on the patient matching topic, while they're separate, they're highly related, as Lindsey just connected them. And one of the benefits of picking a verification provider that has a large footprint is you've got a lot of patients already in a database that have what we call a universal user identification number. So we have 116 million Americans already verified on our platform, 50 plus million that have already been identified at IL2 standards for healthcare. That universal ID exists even if they haven't logged in to Marc or Lindsey or any other application yet. And so we pass that over to our customers who can then use that in that infrastructure that they're using for patient matching, so that when they pull the right records to present to either the providers for additional healthcare or back to the patients for their records, we know that, or they know that they've used this verified identity to connect the right information for the right person to the right party. And so, there's a lot of things that go into identity verification, as we've talked about today, but I would leave it with it's got to be trusted at the right levels for healthcare, which is IL2. It's got to be portable because we log into, like Marc said, at least 5 applications out of the gate. And as interoperability and technology continue to evolve, it's going to be dozens. And so one ID everywhere you go is really what we're focused on. And it's got to be frictionless. The end consumer needs to be able to use it very simply and get into the information, especially in the healthcare ecosystem, without friction, without pause. And when there is trouble, they get it resolved quickly.
Thanks, Jason. Marc, I'll go right to you next here, Ryan. Any last remarks? We have just a minute or two left.
Yeah, so we have a group here that's working on solving problems, and we just need more folks to join us. So as you, if you're representing a health system or health plan or technology company and want to join this mission, please contact Kyle at DirectTrust or Ryan at Caring Alliance to join us. And we are actively working on these solutions. Jason at ID.me and I have been working on a TEFCA project with Health Gorilla and some other organizations. And so that's just one small example, as well as the proof of concept that Kyle mentioned that we've worked on together. So join us on this mission to make patient identity more accessible to more people around the country.
Thanks, Marc. And Ryan, just 30 seconds.
There's a huge problem with patient matching. We've never involved the patient. So let's involve the patient, because they're the source of their demographics, as the source of truth, because the patient is the only constant in healthcare. Last thing I'll say, Kyle, is breaking policy news here. HHS just released their healthcare cybersecurity guidance today. And in that guidance, it actually says that HHS will work with Congress to obtain new authority and funding to administer financial support for domestic hospital investments in cybersecurity for implementing essential things. This is an essential item for cybersecurity. If in fact HHS can work with Congress, you can debate whether that's going to happen or not, but the Biden-Harris administration follows through with their national cybersecurity policy starting in March, and now with the HHS's follow-up, you could see a model where potentially there could be a new incentive program for hospitals actually to implement this type of technology to increase cybersecurity. And I guess final thing, 2.5 things. We are ahead of any other industry out there in terms of how we think about this. Financial services, any of the others that are out there healthcare is finally ahead. Let's stay ahead and let's keep pushing pushing the bar forward on this stuff. So,
And thank you, Jason,
Great.
Lindsey. Great panel session. Thank you all very much. Carol, turn it over to you.
Yep. Thank you all. That was terrific. And we're going to move on along, as I say, as